The current coronavirus pandemic that is sweeping the globe reinforces the importance of principles in our lives, specifically the principles of health. A principle is a fundamental truth, and there are principles that dictate health and disease. So by knowing the principles that lead to health, we can increase our ability to prevent coronavirus and or recover from coronavirus. And that's what I want to cover in today's video. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Whenever you're struggling in an area in life, it's good to return to the principles or the fundamentals in whatever area you're in to help you move forward, whether you're struggling on a test or struggling with a pandemic. And from the perspective of health and disease, there are principles that promote health, and these are universal, and you know them. We give them lip service, we just may not always implement them. What are the principles of health? Well, how about a healthy diet? A principled diet that promotes health is a diet that focuses on nature, focuses on non-GMO foods, non-adulterated by man foods. So our meats eating what they should eat. So a cow eating grass, not corn or soy, right? Our vegetables and fruits being grown in organic soil in a non-GMO way, not being sprayed with glyphosate and other herbicides and pesticides. That leads to a healthy diet. Optimal sleep, healthy sleep that is entrained with the light-dark cycles of the sun. Physical activity every single day. The benefits of physical activity are almost limitless, and if you're not physically active, your body is suffering in multiple ways. And then we are a species that requires community, and so social isolation has been shown in the research to increase your risk of death from all causes and all age groups at a level that's greater than smoking and greater than obesity. So if we are, as a species, not in community, if we're socially isolating ourselves, maybe through social distancing or through quarantine, we really need to ask, is this the most beneficial thing for this individual? So these are the principles of health, and there are many others, but these are the fundamentals, the principles that if we can implement these every day, we're creating a healthy environment, a healthy internal milieu inside of us that will help us best prevent infection in general and infection with coronavirus specifically. And if we were to be infected by coronavirus, it gives us the best opportunity or best chance to recover or not follow us or go down a severe course. Why? Because we are not inflamed, or we are living an anti-inflammatory life. If you look at the coronavirus statistics, the individuals that are at greatest risk are the individuals that are most inflamed. The elderly and people with predisposing diseases, like lung disease, heart disease, diabetes, autoimmune disease, inflammatory disease in general. If you are inflamed, your risk of infection via coronavirus is higher, and your risk for going down a more severe disease course and potentially dying is higher. Why? Because your internal milieu, your internal environment is not healthy, it's inflamed, it's not anti-inflammatory. That person is not as close to principled health as would be optimal. So this discussion goes back to Louis Pasteur and the germ theory, and a contemporary of his, Antoine Béchamp, who promoted the terrain theory. Béchamp said, it's not the germ, Louis, it's the terrain. And what does that mean? Well, you've seen this in your own life. You've gone to a party with your spouse, you've shook the same hands, you've hugged the same people, you've eaten the same food, and you come home, and in the next week, one of you is sick and one of you isn't. Why? You're exposed to the same germs. If it was all about the germ, you should have both got sick, right? But it's not all about the germ, it's all about the terrain. And so one of you, your terrain was healthier and less anti-inflammatory and more robust and able to prevent infection with that germ, whereas the other person who got sick, their terrain was not as healthy. So we want to think about the principles that promote a healthy terrain. Good food, good sleep, physical activity, community, right? Healthy thoughts. Now, the higher inflammation level in your body, the higher your risk for coronavirus. So we want to promote an anti-inflammatory environment. We want to live these principles. And this doesn't just relate to people with predisposing conditions. So yes, with lung disease and heart disease and diabetes, it matters, but there's a scale, right? So on the most extreme end is the diabetes and the heart disease and the lung disease, but in the mid-range could be leaky gut, could be food reactions, could be allergies, could be things that are not seen as outright disease, but they're states of increased inflammation compared to optimal or low inflammation. So there's a scale, and maybe the people with allergies or leaky gut and the inflammation related to that don't go severe and die from coronavirus, but maybe those are people that show symptomatology versus people who are exposed and are just carriers or asymptomatic. So the goal is to be as anti-inflammatory as possible, so that you fall into that 80+% of people who, if they're exposed, will have mild symptoms, never need to go to the doctor, and recover no problem. How do you fall into that category? Living the principled life, living the principles of health that apply every day, not just during a pandemic, but these are things I've taught for years that apply whether there's a pandemic or not. So if you're someone that is inflamed, starting today to live the principled life can turn that ship around and move you towards that anti-inflammatory life. So if you're stacking good days together as you're building momentum over time, you're decreasing your risk of infection, you're decreasing your risk of severity if you are infected, you're changing your terrain toward one that's more robust and more healthy. Now, are there natural strategies that the research says can be effective in coronavirus? Yes, there are. A colleague of mine, Dr. Alex Vasquez, recently put out an excellent 7-video series on natural strategies stacked with peer-reviewed research that can be used for coronavirus. And the Journal of Medical Virology just came out in the last week, in the last month, with a paper called Potential Interventions for Novel Coronavirus in China, a systematic review. And what these authors did is they looked at vitamins and other natural strategies that have science behind them that could be used in coronavirus, and they also look at antiviral drugs that have the possibility of being used for coronavirus. So Dr. Vasquez said in his video series, vitamin A, vitamin D, zinc, selenium, glycyrrhizin, vitamin C. He named multiple nutrients. Well, this study also lists multiple nutrients. So B vitamins, vitamin C, vitamin D, vitamin E, omega-3 fatty acids or fish oils, selenium, zinc. Okay, those are nutrients. Then there's various medications that they discuss, and Chinese medicine, so glycyrrhizin, which Dr. Vasquez mentioned, is a licorice root extract. And then there's different protease inhibitors and enzymes that you can get from things like papain. So I want you to know that there are people working out there looking for natural strategies. It's not all about a vaccine savior. There are things we can do right now that increase our immune robustness, our immune surveillance, and our terrain to be able to prevent the infection or respond optimally to if we are to get infected, to recover optimally. So return to the principles. If you're not doing them, begin doing them today. That's what you can take action on right away. Start building momentum and feeling good that, hey, I stacked 2 good days together. I put a 3rd day together. I'm role modeling for my kids and now they're doing it, so I know they're going to be healthier. You don't have to be powerless in this moment. You don't have to watch the news and social media and be living an Armageddon life. You can take action and role model for your kids and do things right now to improve your chances, your health, your terrain, so you can live a life at optimal.